Peripheral Neuropathy Treatment. You are watching a GoodHealthTube.com production. This video will specifically discuss treatment for peripheral neuropathy. There are several options available. We will also include information later in the video about an enzymatic discovery that can change everything when it comes to approaching peripheral neuropathy. But before we go deeper into peripheral neuropathy treatment, we will quickly remind ourselves what peripheral neuropathy is. Peripheral neuropathy is when the peripheral nerves are diseased or damaged. Peripheral nerves are nerves outside of the brain and spinal cord. These nerves make up the peripheral nervous system. The brain and spinal cord make up the central nervous system. Also, regarding peripheral neuropathy, there is sensory peripheral neuropathy which affects the sensory nerves, motor peripheral neuropathy which affects the motor nerves, and autonomic peripheral neuropathy which affects the autonomic nerves. You can watch other videos in our neuropathy playlist to learn much more about these types of peripheral neuropathies, diagnosing peripheral neuropathy, causes of peripheral neuropathy, and more. We will now discuss the treatment categories of peripheral neuropathy. So just how is peripheral neuropathy treated? The following are the broad categories which we will go into in detail. Pain medications, seizure and depression medications, dietary and lifestyle practices, transcutaneous electrical nerve stimulation, immunosuppressive and immunomodulatory therapies, physiotherapy and occupational therapy, orthopedic braces and support, surgery, acupuncture, mind-body practices, and cognitive therapy. Now let's deal with each of these categories one at a time. Medications. There are several options when it comes to treating peripheral neuropathy symptoms with medication, and most of these options involve reducing pain or inhibiting the pain signals along the nerves. Nonsteroidal anti-inflammatory drugs, NSAIDs, and other over-the-counter medications can relieve pain and discomfort. Moreover, if the pain is localized, topical medications such as lidocaine patches or creams may be effective giving localized pain relief. Capsaicin cream, which is derived from a compound found in hot peppers, may alleviate some neuropathic pain and itching. Some of the more common non-steroidal anti-inflammatory drugs include Motrin, which is the same as ibuprofen and Advil, and naproxen, which is the same as Aleve. Aspirin, which is also a non-steroidal anti-inflammatory drug, may be used. One must be careful as the side effects of taking too much of these medications can result in kidney disease and kidney damage and the development of peptic ulcers in the stomach. Acetaminophen, which is the active ingredient in Tylenol, can also help with mild pain. Acetaminophen is not a non-steroid anti-inflammatory drug, and is not known to cause kidney diseases or peptic ulcers. Taking too much acetaminophen, however, can lead to liver disease and even liver failure. Acetaminophen is over-the-counter. In cases of severe pain from peripheral neuropathy, narcotics can be used. Narcotics are the same as opioid drugs. These potent painkillers can be habit-forming, so it is crucial to use them only as prescribed by a qualified healthcare professional. They are also prone to abuse and are contributing to the opioid crisis. They also have certain side effects such as sedation, constipation, lethargy, brain fog, and respiratory depression, which can even lead to death. Common narcotics used include oxycodone, Percocet, which is oxycodone and acetaminophen, hydrocodone acetaminophen, Norco, Lortab, Tylenol with codeine, OxyContin, Dilaudid, morphine, fentanyl, and tramadol. The difference between non-steroidal anti-inflammatory drugs and narcotics. Non-steroidal anti-inflammatory drugs, NSAIDs, reduce pain by inhibiting enzymes involved in the inflammatory process, in particular an enzyme known as the COX enzyme. Narcotics reduce pain by attaching themselves to certain pain receptors in the brain, thereby blocking pain signals to the brain. Narcotics, opioids, do not inhibit inflammation. It is not uncommon for people to take non-steroidal anti-inflammatory drugs and narcotics at the same time as part of a pain control regimen. The bottom line with non-steroidal anti-inflammatory medications and narcotics is that they decrease the pain felt with peripheral neuropathy, but they don't treat the underlying condition. They won't repair the peripheral nerves. The peripheral nervous system is still diseased or damaged. Other medications to treat peripheral neuropathy symptoms. Some antidepressants and anticonvulsants may also be useful in treating the symptoms of peripheral neuropathy, even though they also have effects in the central nervous system to treat other neurological diseases. You do not need to be depressed or have seizures to experience relief from neuropathic pain with these medications. Some of these medicines include amitriptyline, gabapentin, carbamazepine, Tegretol, and lamotrigine, Lamictal. These medications are known to interfere with the way pain is transmitted in nerve cells. In addition, some physicians may prescribe medications to treat the underlying condition causing your neuropathy. This strategy may involve the use of medications to treat infections or mitigate the effects of diabetes, hypertension, autoimmune diseases, and circulatory conditions. Examples of treating underlying conditions include steroids for autoimmune disorders and blood thinners to improve circulation. All of these strategies need the guidance of a qualified healthcare professional. Dietary and lifestyle practices. Certain vitamin deficiencies, such as B12 deficiency, can contribute to peripheral neuropathy. A diet consisting of whole unprocessed grains, fruits, vegetables, and lean proteins can prevent further nerve damage and limit the symptoms of peripheral neuropathy. Additionally, a healthy diet improves the body's overall functionality. Keeping your blood sugar in a healthy range will definitely help with peripheral neuropathy. Blood tests should be checked on a regular basis. Additionally, regular exercise is beneficial for maintaining a healthy weight, regulating blood sugar, and preserving muscle strength. However, consult your physician before beginning a new exercise regimen, especially if you suffer from peripheral neuropathy. Even a light exercise regimen of walking can improve symptoms of peripheral neuropathy. Additionally, tobacco products and excessive alcohol consumption likely contribute to nerve damage and peripheral neuropathy. While quitting smoking is difficult, there are numerous programs and medications available to assist with withdrawal symptoms. Alcohol should be consumed no more than 1 to 2 times per day, and even this may be pushing it for certain individuals. Transcutaneous electrical nerve stimulation, also known as TENS. When using a TENS machine to treat peripheral neuropathy, special stickers, electrodes, that you adhere to your skin deliver electrical impulses to the affected area of your body. These machines can be used at home and are available over the counter. Electrical impulses are frequently experienced as a tingling sensation and muscle twitches. Electrical impulses can inhibit the transmission of pain signals from multiple nerves to the spinal cord and brain, thereby relieving pain and relaxing muscles. TENS, however, is not effective for everyone. It may be unpleasant, but it should not be painful. There may be skin irritation where the electrodes are adhered. TENS cannot be used in the shower or bath. A TENS unit allows the user to manage pain for a variety of durations. Typically, the duration of pain relief ranges from 5 minutes to 24 hours. Generally, the level of pain relief will vary based on the nature and severity of the pain. TENS therapy is nevertheless a worthwhile alternative to medications when treating peripheral neuropathy symptoms, particularly with chronic pain. Immunosuppressive and immunomodulatory therapies. If your peripheral neuropathy is caused by an autoimmune disorder, your doctor may select one of several treatments. Treatment options include oral medications and IV infusions. Typical medications that your doctor may prescribe include azathioprine and prednisone, for example. These immunosuppressants decrease inflammation from the immune system and can relieve nerve pain. Plasmapheresis is a further immunosuppressive therapy. During this sophisticated procedure, blood is extracted from the patient's body. Immune cells and antibodies are subsequently removed from the extracted blood, which is then returned to the body. This is very helpful specifically for immunogenic peripheral neuropathy. Physiotherapy and occupational therapy. Physical therapy employs targeted exercises, routines, massage, and other techniques to improve coordination, posture, and strength. Physical therapy can treat muscle weakness resulting from motor nerve damage from motor neuropathy. Physical therapists may also recommend modifying your daily activities, such as sitting or walking, if they are contributing to your discomfort. Occupational therapy similarly addresses how to recover from or adapt to functional changes caused by nerve damage. An occupational therapist can recommend adaptive equipment, additional exercises, and alternative methods for performing daily activities. Examples of adaptive equipment include walkers, canes, orthotics, Velcro clothing, and long-handle shoehorns. While these therapies don't reverse the effects of peripheral neuropathy, they can certainly help one cope with the nerve damage that has taken place. Orthopedic braces and support. Similar to occupational adaptive equipment, mechanical aids such as foot or hand braces may help to alleviate pain or neuropathy symptoms. For instance, those with carpal tunnel syndrome may use splints. These splints allow for improved wrist positioning and relieving nerve compression. Diabetes-specific footwear can help reduce the risk of skin breakdown in the feet and provide additional support. Those with muscle weakness may also require the assistance of a cane or other mobility aids. Surgery. In severe cases of peripheral neuropathy, surgery may be the best treatment option. Surgical procedures can relieve the pressure on a damaged nerve. Those with tumors, a herniated disc in the neck or back, or nerve entrapment may be candidates for surgery, such as carpal tunnel syndrome. As surgical technology continues to advance, an increasing number of peripheral neuropathy-related surgical procedures are minimally invasive. Minimally invasive surgery employs smaller incisions and precise, miniature instruments. Consequently, one can anticipate less scarring, less pain, and a quicker recovery time. Acupuncture. Acupuncture is a traditional Chinese technique for promoting natural healing and enhancing function. Depending on the location of pain or other symptoms, needles are inserted into the body at very specific points. Acupuncture is believed to unblock the body's energy channels, also known as meridians. A more modern explanation is that needles can stimulate the nervous system when precisely positioned. In turn, this results in the release of chemicals, or a chain reaction of chemicals and hormones, that alter the perception of pain of the affected nerves and other symptoms. Some acupuncture practitioners can actually use electrical stimulation instead of needles if you dislike needles. Another variation of this practice is acupressure. These techniques are particularly helpful with sensory neuropathy. Mind-body practices. Mind-body techniques like deep breathing, meditation, yoga, and Tai Chi are also treatment options for those struggling with peripheral neuropathy. Typically, these practices are used in conjunction with more conventional medicine. In particular, these practices can lead to a more mindful experience of what is going on with you physically, mentally, and emotionally. This, in turn, can reduce stress and pain, promote relaxation, and improve your quality of life. Some of the more physical mind-body practices, like yoga or Tai Chi, can also assist with flexibility and muscle tone. Cognitive treatment. Cognitive therapy is a type of psychotherapy in which negative thought patterns about the self and the world are challenged in order to modify undesirable behavior patterns or treat mood disorders like depression. Individuals with disabilities and/or chronic health conditions may benefit from discussing their condition with a therapist. It is not always simple to deal with being unable to participate in the activities you enjoy. A psychotherapist can provide you with the tools and support necessary to investigate and manage your thoughts and emotions. Enzymatic Discovery. Before we recap and conclude this video, we wanted to mention the discovery of an enzyme that has the potential to change the approach to peripheral neuropathy, including coping with neuropathy pain. We encourage you to learn more about this discovery by clicking the link in either the video description or the pinned comment below. Let's now recap this video. There are several treatment options and strategies when dealing with neuropathy pain from peripheral neuropathy, which is disease or damage to the peripheral nervous system. This is important as peripheral neuropathy affects between 20 and 30 million people in the U.S. alone, and almost 200 million people worldwide. Medications including, non-steroidal anti-inflammatory medications, narcotics, anti-seizure medications and medications to treat underlying conditions such as diabetes and autoimmune disorders can be used. Dietary and lifestyle changes include nutritional and certain vitamin deficiencies, the cessation of smoking, and reduction of alcohol intake. Exercising regularly, even with a simple daily walk, can be beneficial. Checking blood tests for sugar levels in diabetes will help. Using a TENS machine can be a useful alternative instead of oral pain relievers. Certain immunosuppressives and other treatments such as plasmapheresis can help. Physical therapy and occupational therapy with the use of adaptive equipment can help one cope and functionally recover from nerve damage from peripheral neuropathy. Orthopedic braces and support can help with muscle weakness. Other treatments such as acupuncture, mind-body techniques, and cognitive therapy can also be of benefit. We hope you have enjoyed watching this video on peripheral neuropathy treatments. Don't forget to check out the Enzymatic Discovery that has the potential to change our approaches to peripheral neuropathy. A link will be in the description or the pinned comment. Please like, subscribe, and comment. More valuable videos such as this are in the pipeline, which you can watch in our neuropathy playlist. A playlist link is in the description. Hit the notification bell to be notified when more videos become available. This video is not a substitute for consulting a physician. It is not intended as medical advice. It is intended solely for educational and informative purposes. Always consult a healthcare professional before beginning a new health plan. You have been watching a production of GoodHealthTube.com. Thanks for watching.